Hi everyone, my name is Dr. Stephen Carlson. I am a board-certified physician in gastroenterology at Community and have been with the network for over 25 years. I also currently serve in the role as the network GI Medical Director. As you might have heard, March is Colorectal Cancer Awareness Month, a time when we stress the importance of colorectal health. So today we're going to take a few minutes to talk about colorectal cancer, why and when you should get a colonoscopy, and discuss the current recommendations for colorectal cancer screening. My goal is to help you understand how the screening process works and learn more about colorectal cancer prevention. So let's get started. If caught early, colon cancer is very treatable and even curable. Even in its later stages, community physicians and caregivers can provide the most cutting-edge treatments with the best outcomes. But the best news is that colon cancer is preventable. Here is a great question. As we will discuss, colonoscopy can prevent, not just detect, colon cancer. Colorectal cancer is a cancer that starts in the large intestine, colon, or rectum. It often begins as small, non-cancerous clumps of cells called polyps that form on the inside of the colon. Over time, some of these polyps can increase in size, undergo cellular changes, and eventually transform into a colon cancer. Colorectal cancer screenings can detect polyps and cancer early, thereby preventing the disease from developing or spreading. Now, there are many screening methods available to patients. However, only colonoscopy screening can identify these polyps and remove them before cancer occurs. Stool tests are limited in that they are only useful in detecting cancer, but not preventing cancer before it occurs. Throughout my career, I've witnessed a true paradigm change where we now speak about cancer prevention rather than colon cancer screening due to the increasing accessibility and the technological breakthroughs of colonoscopy. Colonoscopy is regarded as the highest level gold standard recommendation since it is intended to identify and remove polyps before they can develop into a cancer. Now, if you are unable or unwilling to get a colonoscopy for medical reasons, then an annual FIT stool test is the best alternative. Tier 2 options are available, but not recommended as these secondary tests are not good at polyp detection. Remember, the polyp detection and removal is the goal to prevent cancer. During a colonoscopy, a long flexible tube called a colonoscope is inserted into the rectum. A tiny video camera at the tip of the tube allows the doctor to detect abnormalities inside the colon. When polyps are found, the doctor can usually safely and completely remove them through the scope, thereby preventing the development of colon cancer. Over my career, I have seen significant advances in colonoscopy technologies and techniques that have greatly increased the detection of polyps, and even now allow for removal of larger polyps that once required surgery. The procedure takes about 15 minutes. You will need to allow additional time to check in and recover after the procedure if you receive sedation. The procedure itself has become quite comfortable experience as sedation techniques continue to improve. It's not uncommon for a patient to say at the end, "That's it, we're done." The preparation the day before has also improved, as the laxative preps have become more palatable and require less volume at one time. Overall, most patients now describe the procedure as a pleasant and comfortable experience. We are fortunate that at all regions throughout the network, we have extremely skilled gastroenterologists and colorectal specialists that can provide the highest quality colonoscopy. Now, in 2021, the recommendations for colorectal cancer was updated to begin screening at age 45. This is because the rate of diagnosis is increasing at younger ages. If it is normal, it should be repeated in 10 years. If polyps are removed, a repeat screening will be recommended at 3 or 5 or 7 years based on the size and number. In general, once we hit the age of 75, routine screening can be individualized based on a patient's health. If there's a family history of colon cancer, such as parents, siblings, or multiple extended family members, the risk is increased. In these situations, screening should begin every 5 years, starting at the age of 40 or 10 years younger than the family member. Now, you can discuss all this with your primary care provider, such that if you think that you are at a higher risk of colorectal cancer, talking with your doctor would be the first step. While our goal is to prevent colon cancer, it's important to review some warning signs and symptoms of colorectal cancer that you should discuss with your healthcare provider as soon as possible. The most common symptoms of colorectal cancer include a persistent change in bowel habits, including diarrhea or constipation or a change in stool consistency, rectal bleeding or blood in your stool, a new persistent abdominal discomfort such as cramps, gas, or pain, a feeling that your bowel doesn't empty completely, weakness or fatigued, or unexplained weight loss. Patients often tell me that they've chosen to delay screening since they are not exhibiting any symptoms. Sadly, many patients show no symptoms at all. By the time these symptoms appear, cancer may have already taken hold. That's why it's crucially important to have a conversation with your healthcare provider to discuss your risks and schedule a colonoscopy if appropriate. Cancer and nutrition experts say that up to 50% of colorectal cancers are preventable by combining a diet that includes fiber with daily physical activity and weight management. Eat more fiber. Just 10 grams a day of fiber can reduce your colorectal cancer risk by 10%. Cut calories to reduce excess abdominal fat. Belly fat is linked to changes in insulin and increased inflammation. Drink alcohol in moderation. More than 1 drink for women or 2 drinks per day for men increases the colon cancer risk by 14%. Limit processed and red meats. Try fish and meatless meals that include beans for protein. Stop smoking. Add cancer-fighting foods to your diet. Garlic, calcium-rich foods, deep green cruciferous veggies, red and orange fruits. Even small changes in lifestyle habits can have a big impact on your overall well-being. Now, I'm not going to end this presentation by saying something like, only you can prevent colon cancer, even though I just did, because actually you can. First, start with the lifestyle modifications I discussed. Even small steps can help. Second, use this Colon Cancer Awareness Month as an inspiration to contact your provider and tell them, rather than discussing colon cancer screening, you would like to discuss colon cancer prevention. I guarantee your provider will be quite impressed by your insightful perspective. Remember, Colorectal cancer is a preventable condition, and a colonoscopy can save your life.